bit about how we can continue to help our clients during this stressful time and even beyond when things get back to some semblance of normalcy. So we're going to focus a little bit today on head, neck, and jaw pain, how we can help that population, because that represents a huge population of pain patients. And for those of you who deal with in the dental world, we're always telling our patients that stress makes clenching and grinding of our teeth worse, and that stress exacerbates our headaches, our neck pain, tension. And so I was thinking to myself, could there possibly be a more stressful time to be living through than what we're going through right now? And what is happening to that population? Where are they going? How are they getting the effective care that they need during this time when many offices are closed and patients don't know where to go to in the first place? So today we're going to talk a little bit about a protocol that is already readily available. It's already validated. It's been driven by pain patients and validated by pain specialists. So it's what I love about the product and the protocol, because it's been utilized and been proven to be effective. So we're going to talk a little bit about that, and then how you, as a caring person, as a caring healthcare provider or patient advocate, how you could be a health coach and help this population. So we'll go through the presentation, I'll explain and I'll lay it all out for you. And then at the end, we can address any questions. So hello, everybody. Thank you for joining us. And if you're going through here and you guys are so cute. If you're going through and you think of somebody that this might benefit, then please share it with them. And I know it's been so long since we've all seen each other in person, and I'm virtually hugging you all back right now. So thank you for all you're doing out there. And hopefully we can share our knowledge and benefit our patients, and also continue to advance our profession while we're doing it. So I'm going to share my screen with you, and we will get started. Okay. So the protocol is part and parcel of a kit called the Speed2Treat Home Healing Kit for head, neck, and jaw injury. Head, neck, and jaw pain represents a huge portion of disability in North America. And along with head, neck, and jaw pain follows back pain. And we will discuss another time why that is, why having a head, neck, or jaw injury could end up leading to lower back pain as well. So the protocol we're going to discuss today follows an orthopedic model of care. My background is in emergency medicine, so this makes a lot of sense to me because, for example, if you rolled your ankle, you sprained your ankle, many people come to the emergency department worried that their ankle is broken, because when you sprain or strain a joint, there is quite a bit of pain that goes along with it, pain and disability. So you're hobbling along, you don't want to put any weight on it, you come to the emergency department, and a few things will happen. One, we'll put ice on it, right? We're going to put ice on it and decrease the inflammation right away. Maybe you'll get an x-ray, maybe you won't, because we'll do some palpation, we'll do some checking to see if the joint is intact. Not everybody automatically goes for an x-ray, because there are pretty standard basic models of care that we follow. So we would wrap it, put like a compression bandage on it to provide some support to the joint, continue with the ice, might encourage some anti-inflammatory, over-the-counter anti-inflammatory medication. And we would encourage you to stay off of it. Rest the ankle for a while. Elevate it if you could. The difference with jaw pain is that with ankles, we have this protocol in place, and we've been doing it for a long time. The ankle, when you go to the emergency department, you are not expecting to see an orthopedic surgeon because you rolled your ankle. You're not expecting to see a specialist in ankles. You're basically going for some first aid. If you had the supplies at home, likely you would wrap it, you would ice it. If you had crutches, you might use them for a few days to stay off of it. But that standard of care has become so well known and we just trust it. With every joint, it's basically the same thing. If you sprain your wrist, if you sprain your knee, we would splint it, tell you to minimize use of it, and rarely would you ever need to go see a specialist. When it comes to the jaw, there's never really been a clearly defined way to manage the jaw joint, because the jaw joint is unique in that we need to continue to use it to eat, we swallow, we smile, we speak. So we're still using it, and the jaw joint is one bone connected to two joints. So it is unique. However, our model of care for treating a sprain or strain to the jaw area, an acute injury or pain, would be the same. And we'll talk about that as we go through. So what is jaw and muscle sprain or strain? We see patients that come in because they yawned and their jaw pops or clicks and they can't close it down again, or they take a bite into something and they feel a pop and they have pain afterwards. They have a sports injury, they're elbowed. Maybe they've had a long dental procedure, their mouth was held open, wider than normal for longer than normal, and that can produce a strain on that area. Intubation, I'm going to come back to that. Mild whiplash injuries and mild concussion. So anything that affects this whole head, neck, jaw area has the potential to put strain on our jaw joints. Think about right now what we're dealing with in this virus. People are stressed. First of all, we have, yes, all the stress and financial things and strain on that area. But what about those folks that are being intubated? So I know in the emergency department, if we're worried about saving your life, we're certainly not thinking about your TM joints. We are getting our ET tube and, we're just wrenching that jaw open to get that tube in there because we're trying to save your life. The problem becomes after, when you're extubated and you've got chronic headaches or you have pain and you don't understand why. There will be a whole population of people that will need supportive care following treatment for this virus. Even if you weren't intubated, the decrease in oxygen saturation is going to have an effect on the firing of those muscles. So there's lots of potential injury in addition to the population that already exists. So how do we know if somebody has acute pain to that area? What does that look like? So somebody might complain of localized pain. They might be able to pinpoint it hurts right here. Or when they're trying to use that area and they're speaking or they're trying to eat or chew, they're finding that there's discomfort. Maybe they can't open their mouth as wide. So the limited range of motion. And usually you see it in an inability to open too wide and pain and discomfort from turning your head. Some people end up with photophobia and phonophobia, or kind of migraine-like symptoms from an injury to their jaw area. So those are the patients that we can do so much for. We can intervene early and really, really help this population. We don't have to become experts in order to help them. And in fact, the studies show that the majority of people who actively engage in this 4-week care plan that we're going to share with you today were able to return to normal function without any further intervention. So some studies say 70%, some studies say 83%. There are a huge number. Just like you would fully expect if you brought your loved one to the hospital for a sprained ankle, you're not thinking they're going to have a lifetime of disability. You're not thinking that they're going to become an ankle patient. But for some reason, when we're talking about the jaw area and somebody has an injury or pain to this area, we automatically go to they're a TMD patient or a TMJ patient. And that doesn't have to be. That doesn't have to be. And in fact, most times that occurs because we are not helping and we're not intervening early. So here is the care plan. And you're going to see this slide a few times because we're going to keep referring back to it. What is the next step that we do? So the care plan is a 4-week care plan, and it helps us to stratify folks that might need more care. But like we just mentioned, the majority of people will resolve by following this care plan. So the first interaction with that person, there is an included pain tracker. We're going to do an assessment for pain. I like to use an anomic sample pain, and we'll go over that for those of you who are interested in becoming a health coach and taking this on a more dedicated way. We'll talk about the mnemonic that you can go through to help do a very thorough pain evaluation with them. So they have the pain tracker and they start with how they feel today. We'll repeat the pain tracker later. If they are coming to your office on an emergency basis, so they have pain and they come to the office, it's an emergency, you might help them right then and there to start by making the quick splint, filling out the pain tracker, and going over the guidebook contents. But given that many offices are closed, given that many people are isolated at home, Speed2Treat is offering to drop ship for you to the client's home. So in that case, it would be delivered, and then once they have it, you would arrange to start the program with them. So it's preferable if at the moment the patient complains of pain that you could just hand it to them. But like I just mentioned, that's not always possible right now. And even when we go back to so-called normal, if your office is busy and you're fully booked, you may not have the time right at that moment, but you can begin care by handing them a Speed2Treat Home Healing Kit and get them started on a path to recovery as soon as possible. So basically the screening, having them look at the contents, and much of this will be done over the phone when the patient receives their kit. I want to emphasize this is not something that is new. It's not something that we've just popping out because of the situation now. This is a program that has been around for years, designed by pain experts, used by many pain experts in office. But now they have developed a kit last year that is available to go to the home with the patient to support the patient in home, so that they have 30 days now of self-care that is monitored and supported by you. The kit includes many videos that will educate the patient and guide them through the steps. So Dr. Frickton has narrated these videos, and some of them, the patient might just use the very bare minimum. Others that want to know more about their condition will have the ability to go and dig deeper. There's a number of videos for them. And some of the most basic ones are, for example, just showing them how to make a quick splint, going through the contents of the kit. I'll show you one later on that is an overview of the kit. This is the pain tracker. This helps the patient to see if progress is occurring. Sometimes when you have pain, the progress is incremental. You might feel like you're taking 2 steps forward and 1 step back. It's helpful to look and see how far you've come. So we always want to make sure we get the patient to fill out how they're feeling today. Then at the end of week 1, week 2, week 3, week 4, we want to be able to see where they're making progress or if they're not. And then that helps us to have a conversation with them on what self-care steps maybe the patient has omitted that could be helpful. Maybe we could encourage them and motivate them to stay on track with the care plan because we were seeing progress and now we haven't. So we can have a conversation with them about is there any more stress in their life? What types of things might be contributing to their pain? What did they find effective before? Could we try that again? So it's just basically helping them to think in a more mindful way about their pain. But if despite all those efforts and encouragement at the end of 2 weeks, we've seen no progress with pain, and in fact, the patient feels like they're getting worse, well, in that situation, then we definitely would refer them on to see a provider or a specialist. The same way with any other joint. If I twisted my knee and I was on crutches and the swelling was not going down, in fact, the swelling was getting worse, my pain was getting worse, I would go and see a specialist. But the majority of times, I'm going to have a steady decline of pain and inflammation. And we expect the same with the jaw. There are so many studies that show that self-care improves recovery and helping to draw a person's attention to some of the habits that they could have that might be contributing to their symptoms or worsening their symptoms. That is vital. Any healthcare provider can tell you that I can educate in my office and I can tell the patient what needs to be done. But between that time and the time I see them again, the patient's recovery largely depends on what they're doing at home. And for the most part, people just don't know what to do. They don't know what is effective. And so this program really helps to guide them and say, here's what the research shows. If you apply ice, for example, or cold during the first 24 hours of an injury, you will decrease the inflammation and reduce pain severity. So we might want to have that conversation with them. Each of these steps has been designed to get them back to their normal as soon as possible. So it's really like having a pain specialist in your home with you, holding your hand, saying, come on, the next thing you need to become aware of, the next habit you need to change, the next self-care measure you need to implement is, and it's all in this guidebook for you. The immediate treatment would be one, any anti-inflammatory or over-the-counter anti-inflammatory if they're in severe pain. We always want to get people out of pain as soon as possible because then they can think straight, then they can reason and make more appropriate choices. It's hard to do that when you're in a lot of pain. Quick Splend is an oral appliance that really helps to interrupt the messages, the signaling from the brain to the rest of the body. So when you have an injury to this area, now the pain signals go to the brain and the brain's freaking out and the muscles are firing, and it doesn't matter where your injury is, your muscles fire in response to pain and they clench. What we want to do is get in there and interrupt that clenching. We want to send that message back to the brain to just calm down, everything is fine, and allow the body to heal. So what's awesome about the Quick Splend is it's a temporary custom. I say that because it's molded to your teeth and it holds to your teeth. It's an oral appliance that you wear at night. You wear it while you're sleeping. And while you're sleeping and you have growth hormone being released and you have all sorts of amazing repair and recovery processes that are occurring during night, it's aiding what you're doing during the day. So you're implementing new strategies during the day, reducing negative habits, but you're also during the nighttime still impacting your ability to heal by just relaxing this whole area here, your muscles around your jaw, and that translates into releasing that tension in your neck as well. So amazing part of the Speed2Treat kit for patients. It includes a hot and cold therapy wrap. And as you see in the pictures here, that allows you to pinpoint where you want to direct the heat or the cold, depending on where your pain is. It's also nice around the eyes, especially if you want to lay down and have a rest in the afternoon or at nighttime to cut out the stimuli in your room. But I love that you can put it on the back of your neck, or you could put it directly on your jaw if that's where you're feeling the pain. So that's a really nice bonus, a tool added in the kit. Jaws or sizes. So this is where we want to, just like with an ankle or a knee or any type of injury to any other joint, you wouldn't just go back full stop to what you were doing before. you would incrementally increase your weight bearing, increase range of motion. You might do some gentle movement and stretching. How do you do that with the jaw? The exercises are part of the kit. They are demonstrated in the video, and in the heels, you will be marking off when you're doing them to be mindful of relaxing that area. The other thing for those of you who are in the myofunctional world, SLP, hygienists, airway, we know how important the tongue is. Pain patients, this helps them to focus on where is your tongue. Get your tongue up to the roof of your mouth. Make sure you're not clenching your teeth. Relax your face muscles. Breathe in through your nose. Just this will go so far in helping to alleviate the pain for your patient, but also to give them a sense of well-being and hope for that they can get through this. So tongue posture is very important. One of the cool features of this program is virtual reality and breath coaching. So we talk a lot about Ed Harold. Ed Harold is a breathing coach, but he incorporates mindfulness in it. And he's done a whole series of videos just for pain patients, for patients who struggle with head, neck, and jaw pain, headaches, those types of things. They're really enjoyable. The virtual reality, there's an app you can download to your phone. You slide it into the viewer, and you could enjoy some of those. What I think is really cool is the nighttime one. To view it through the viewer, you actually have to be laying down. And it's a night sky. You're looking up at these stars, these beautiful stars, while Ed is kind of talking in your ear and walking you through a breathing exercise to help wind you down from the day. So I thought that was kind of cool. It actually encourages you to be in the right position. During the daytime, you might be looking at birds. As you're listening to the breathing, you're looking around at a beautiful beach scene, and it's encouraging you to have gentle movement in your neck. So very cool feature. All of these things together, these steps and these programs were put together because of the research that demonstrated what is shown in this slide. The research says that when somebody has an acute injury or pain to this area and we don't intervene, that 5 years later, these folks were still struggling with pain. But if we were able to intervene within the first 30 days, the majority of those folks were back to normal. So intervening early cannot be stressed enough. And that is where having folks at the ready to guide people through this, we could do so much to alleviate the pain crisis that we see happening, and also help people get back to their activities of daily living sooner rather than later. Here's another study that showed that if we intervened early, 50% of folks would recover, 30% of people had very mild symptoms. There's basically only about 20% of folks that need to go on and have further assistance. So if we think about people's perception, though, of an injury to the jaw, they think they have to start on this trajectory of very expensive care, and that takes a long time. Or maybe, changing their whole bite or reconstructing their teeth or whatever. And that may be necessary in some cases, but that is in a few cases. The majority of folks recover quite nicely by just following the model that we've laid out for you today. The other advantage to this program is that it helps us to stratify quickly those ones who will need more care. So we talked about those who don't show any improvement in their pain for 2 weeks, or in fact say they're getting worse. We can intervene quickly. We still want to intervene quickly within that window of opportunity that we have to help that patient. So knowing that sooner rather than later is very helpful. and it helps our patient to be a partner in their pain care. My favorite part about this program, though, is that any healthcare provider can offer it. There is nothing in the kit that you couldn't go and solicit over the counter. There's nothing that you couldn't go and purchase. And you could piecemeal together a self-care program from a number of options that are available out there. So, but the advantage of this program is that it's all been brought together in one kit, the tools that you'll need, and one program with the guidance and education and support that you will need. So I think that's amazing, because some folks, if their patients call or say that they have jaw pain, they're hesitant to get involved, and they say, well, we don't manage that here, or I'm not a specialist in that. The best part about this is you do not need to be a specialist in order to help somebody immediately. That's the beauty of this. And because we never know right from the get-go, we will not know who will be the ones that will recover, the 70% that will recover, 80% versus the 20% that might need something more. So we offer it to everybody. We start everybody off on a basic model, just like we would do in the hospital with an ankle sprain. Everybody basically gets the same treatment. You start to feel worse, then we escalate or we stratify you onto another specialist. It's cost effective. So there are a couple choices for the kits, but it is really cost effective considering what it would cost them to go, the copay to go see a specialist, for example, or to go see their doctor. It really is a cost effective way to help them and allows us to have such a further outreach. The other part of it is if we're doing health coaching, well, there are codes. If you're a provider and you want to do this from your office, there are codes for you to charge billing, or you could do it as a fee for service. You would do 2 consults. The week 1, check in and make the splint, do the pain tracker, review heals, and you could see them again at week 4, but you would be advising them if they don't see any improvement after week 2 to let you know. Or you could do a weekly check-in with them, and we'll talk about that. So let's talk about the step-by-step implementation if this is something that you are interested in getting going with. We go back to our 4-week care plan. So we have our first day, the patient complains of something, or we're reaching out to our patients, those that we know struggle. We're asking them, how are they doing? Can we help them? It would be a great PR for your office to reach out to those patients you know that are struggling with these issues and offer them some support during this time. So the first day is basically getting them familiar with the kit. The following week, we'll talk about where we go from there. So our first evaluation, we're going to do an initial examination. It'll take a couple minutes. We want to know their range of motion. We could do this virtually or through telehealth, telemedicine, Skype, whatever your state has agreed to allow you to use during this time. I know they've made some changes to make it easier for us to see our patients. So figure out what that is for your area. Ask your patient to do range of motion. Can they fit 1 finger in their mouth or can they fit 3? Record it. Neck range of motion. Can they look over their shoulder on both sides, or do they have some limited movement? Ask them to take their fingers, put it on their jaw, open and close. Do they have any sounds? Do they feel any popping? Is there any muscle tenderness or joint tenderness? And ask about any injuries that may have occurred. We'll talk about the exclusionary symptoms in the next slide, but we will basically either provide the kit for our patient or direct them where to go to get it. There is a medical history form available too if you need that, or you could use your office. Exclusionary criteria. If the patient has redness, heat, inflammation over the area, impacted teeth, signs of a fracture, so looking at the gum line and any bleeding or bruising, open wounds, lesions. If their jaw is locked, open or closed, or off to the side, then that's not something that is appropriate for us to intervene with. They would need to go and see somebody who specializes in this. Patient will get a code to go online to have access to all the videos that are available. And they get the guidebook, and the videos outline how to use the guidebook. So it is really self-directed. Some patients require extra support. So here's a little video showing an overview of what it looks like when the patient gets their kit. Patient gets the kit. We've reviewed with them. We're going through the HEALS self-care measure. What does HEALS stand for? HEALS is hot and cold. E is for exercises. A is for analgesic or treatment. L is for lifestyle changes, becoming aware of their habits. S is for stress and strain reduction. So it will go through each of those, and we'll encourage them each day to be applying these. The jaws sizes, they'll get a range of exercises, and we encourage them to do them at least 6 times a day for 10 seconds. It may take up to 7 days to experience the benefit of jaw relaxation, since many patients will clench or brush during the day subconsciously. What was interesting for me is I had no idea I was clenching. I thought everybody's teeth were locked together and I didn't know. And so it takes a while before this area relaxes and softens up, that then you feel yourself firing and clenching during the day. Now I have an awareness of it tied into my symptoms, and I can work on decreasing that habit during the day. And the quick splint will help me to decrease that habit at night. We will help the patient to and advise them to put the packages that come with the wrap in the freezer for 40 minutes. We will walk them through the instructions for making the quick splint if they need help. What's great is that there is enough for them to make a mistake and to repeat it if they need to. But we will advise the patient to stop using the quick splint if their pain is worse. And if they have any worsening of symptoms, we would tell them to stop using it. The idea, though, is it's a temporary device, not long-term, so we shouldn't have to worry about any change to their bite or their teeth. So let's go back to our care plan. We've done week 1. We've talked to them about the hot and cold therapy, the exercises. We've showed them the videos. They've done their pain tracker in week 1 on the first day. At the end of week 1, we're going to get them to do it again. And now we're going to head into week 2. So if the patient is doing well, then we continue to just proceed. We're going to ask them to look at their quick splint and see if there's any etching or any grind marks on the bottom of the quick splint. If we see a lot of wear on there, then that will be a good indicator that they should see their dental provider to talk about having a more permanent night guard made for them. So, and if by week 2 they're still not improving, we're going to reiterate they need to go and see somebody for that. We can encourage, we can support them, we can remind them that it is normal to take up to 4 weeks to recover. So again, if they're getting a little bit discouraged, this is a perfect place for a health coach to come in and support them and remind them and review with them what they're doing, how they're doing it, what could we tweak, but also keep going, because recovery does not happen overnight. We have to allow ourselves the time to heal. Definitely the last question here. Is the patient struggling with anxiety, lifestyle stress, or other issues? Chances are right now, most people are. So even being able to offer lend a supportive ear to hear what people are dealing with and encourage them to take the time out for self-care so that they recover. Okay, so now we are back into second week. Keep going, complete your pain tracker. Let's see how you're doing. Should we follow up and have a telehealth visit with you? And if you're getting better, let's keep going. If you're not, you're going to go see a doctor. So the third appointment is discussing their progress. Are they performing the HEAL self-care measures? Many folks, once they start to feel an initial bit of recovery, will stop doing some of the self-care measures. We want to encourage them to keep going. If you're going to recover fully, keep going with the self-care measures and really turn that into a lifelong change of habits. And continue to ask the same questions to see how they're doing. So week 4, we're going to look at the pain tracker. We want to compare the pain tracker with the one they did on their first day. How does it compare? Are they better? So let's stratify them. We're at the end of the 4 weeks. We're looking at the pain tracker. We're comparing to the first week. Did they recover? Are they better? How is their range of motion? Let's go back through that assessment. How is the pain? How is the tenderness? How is their neck? How does it feel? If they have recovered, then that's fantastic. Now they have the tools. Should they ever relapse? Should they ever have another incident? Should they ever start to feel things tightening? They know they can go back to this kit and start implementing those things again. Hopefully, some of the habits that they've learned over the last 4 weeks, they'll take with them now into the future. What if there were signs that they were grinding and bruxing on the quick splint and they still have some tenderness? Well, we would probably recommend that they be seen by a dentist that could help them. What if they have pathological parafunction? So the wearing or breaking of the teeth, severe tightness, in their masseters and pain in there. They still have that. They've had some improvement, but there's still issues. Well, they would need to go and see a provider that could help them. And if there is no resolution of their symptoms, they should probably go to somebody who specializes in pain of the head, neck, and jaw area. Where can they go? Face My Pain is a directory of integrated healthcare providers that specialize in head, neck, and jaw pain. So you could go to a physical therapist, an osteopath, a dentist, a pain specialist, a neurologist. There's any number of patients that you could go to see. But how do you know who's best for you? Where should you go? Who's in your area? Face My Pain has really done a great job at listing a wide variety of providers so that you can find somebody that aligns with your beliefs, your treatment philosophy, and you can fill out information right on the website. There's a number of search engines that could narrow the search for you so that you could find the right provider. But that is, if you're a health coach, that is a godsend, because when you get your patient to the point where, okay, they need to see somebody else, who do they go to? So we don't qualify the providers or say this one's better than the other one. What we do is we provide you the information so that you can make an appropriate selection for yourself. So if you want to learn more about how to integrate this, how to become a health coach, what are the financials, what are the steps that you need to take to feel confident in providing this service for a number of people who are desperate for your help, then head on over to the Heals Health Coach Facebook page. It's a private group, and we'll be sharing a lot more information over there, and you can ask your questions, and we can help you and guide you into health coaching on that site.